Okay, today Charlie's joining me. He wants to talk about eyes as well. Look at his fierce eyes. Hi, baby. Um, Anytime I'm home, he has to sit on my lap when I'm on my desk, Greta, at my big chair. Your eyes physiologically represent your liver and your gallbladder. Jaundice, you see that in eyes, right in the sclera, the white of the eyes. You'll notice liver dysfunctions, that's jaundice, and gallbladder as well. Psychologically, your eyes represent receptivity because your eyes are receiving information from the outside world, correct? So that's the eyes, and the element associated with eyes is wood. Now, I did recently learn that the color of your eyes does indicate or give you suggestions as to where you should live and how your health could improve based upon that. So, excuse me, what I learned briefly in the video is because my eyes are blue, I'm going to show you here. My eyes are very blue, and when I cry, they get extremely blue. They're like ocean blue. It's really gorgeous. They're associated with mountains and metal. I live near the Rocky Mountains. However, I find Alberta too dry. Every time I go to an island now and I come home, even if the humidity, like when I was in the Bahamas, the humidity wasn't super, super hot or super palpable, it still made a huge difference on my clearing of throat. Like that's a inflammation, right? Phlegm is inflammation. Phlegm is a way to protect your body from inflammation, and it's in my lungs. And you see, I have kind of flat lungs. I likely have a lung fungal infection. So I do this a lot. But when I go on vacation to islands, it goes away. So I'd be curious to learn if living here or close to the mountains would be better for my health, or if I should just live seaside. And quite honestly, I love the ocean, so I'd rather live next to the sea. It's also really good for stress and all that, right? So when I learn more, I will post a video. Sorry, huge delay, hair, whole whack of things. Anyways, so if you have large eyes, like an owl, very large eyes, you're healthy, emotional, and spiritual balance, naturally happy, sentimental, expressive, soft-hearted, friendly, generous, sincere, like attention. If they're smaller, you're curious, reserved, have difficulty expressing innermost feelings, impatient, self-aware, pick up minute details on others, behaviors, and or environments. So when we squint, we're getting down to the nitty-gritty, right? We're trying to hyper focus on something. So having smaller, more narrowed eyes isn't necessarily a bad thing, especially if you have perfectionist lines going on here. It means you're focused and you're being critical of the information you're receiving, and you're trying to deduce it down to something helpful or something determining if it's safe or if you believe that person, anything like that. You're narrowing down your focus to really pinpoint what you're trying to see or hear, whatever. If your eyes are unequal size, you're more or less emotionally guarded, open to what a person is saying, but maybe scrutinizing. That's the word I was looking for. Unequal eye level. So if you're to take a close-up of my face, put a ruler across my eyes, it can indicate that one side of the brain is swollen, which is common in seizure patients. Now, this is not medical advice, okay? I'm just telling you what I know. So unequal eye levels, swelling on one side of the brain. Commonly seen where there's a history of traumatic brain injury, so TBI, or concussion. The injury can be physical, hitting the head on the pavement, or emotional. This is coming up more in the world. We're talking more about emotions and mental states and how they're impacting the body more than just physical. Okay, physical is important, but there's a lot of stuff that happens to us emotionally that can impact our health as well. So if you consider an abusive narcissistic relationship, trigger words, move on. It's like getting whiplash, right? Get told one thing, then they apologize, then they beat you down again, then they apologize and say they love you, right? Like it's a whiplashy effect. And it's traumatizing to your brain. Makes complete and utter sense. So if you can't remember or recall a certain time in your life where you've hit your head or been in a car accident with whiplash, or even just riding a roller coaster and being bashed around in that, there could be an emotion component to the unequal eye levels, okay? and emotional concussions are, I think that's going to be more of a thing. I know the man I learned this from, Todd Frisch, he signed a contract with the U.S. military, I believe, because he's an American, to study soldiers and veterans with PTSD and the emotional component of it, which if you ask him about it, he's very proud about it, very honored, which is very sweet. So if your eyes are wide set, further away from the bridge of your nose, wide set, you're open, ambitious, you're thinkers, good memory, high expectations, you see the big picture, right? Again, if they're wide set, you're seeing more around yourself. Again, when they're more narrow or closer set, you're focusing in on something, right? If your eyes are closer together, become more narrow and focused. People with wide set eyes like to travel and see things, kind-hearted, humanitarians, okay? Close set, focused, detail-oriented, analytical, calculating, successful, irritable, introverted, at worst, narrow-minded. So people who have narrow set eyes, very thin nose, a balanced nose, or a nose that kind of tips under, I would if I had to guess what they did for work, and they seemed kind of reserved, like well-mannered, knowledgeable, but reserved, I would guess they're accountants. Just funny because you get them drunk and they're the complete opposites. but they're hyper-focused. Their narrow nose bridge is hyper-focused. Their eyes narrowing. They can hyper-focus on those numbers and complete that task and not be bothered by it, right? Whereas somebody like me, I'm doing my taxes right now. I hate it. I have to do it chunks of time. And if I did it at the end of every month, I wouldn't have to do it this way. But we like to torture ourselves as humans. So there we go. If your eyes are narrowed, so the opening between your eyelids is narrowed, your acute perceptive abilities, you have acute perceptive abilities, you're watchful, wary, suspicious, calculating, unable to communicate feelings, emotionally guarded, and need privacy. Again, this can come down to just being professional, right? Your acute perceptive abilities of what you do for work, especially while you're working, your eyes may narrow, right? We've talked about this before. Lower Sanpaku, when you can see the lower white portion of the sclera, those people tend to be fanatical, either with religion, health, specific causes, anything like that. They often suffer from hypoglycemia, anxiety, and or panic attacks, tightly wound and moody, and prone to addictions. So if you see somebody, I do believe, I don't think maybe it was Jeffrey Epstein, I'm not positive, but if you have somebody who has lower Sanpaku, who has a bum chin, like they're sexually addicted, they like attention, they have addictions this way, and they're fanatical, and maybe they have bushy, thick eyebrows, tend to like anger, like control, and very passionate, like you can see all this tying to the face. Upper Sanpaku, so that's seeing the top white portion of the sclera. You have an overactive nervous system, adrenal issues, or hyperthyroidism. You tend to be nervous and hysterical. Ron, I can't remember the celebrity who was recently bleep by his son. If you look at his eyes, and his eyes are quite interesting. You see a lot of sclera in his eyes. His eyes themselves appear to be empty, like he's not fully there. And I know this guy's had a host of mental issues that were taken seriously, but then of course, things happen, unfortunately. So he, I do believe his eyes were unlevel as well, indicating a TBI, more than likely emotional due to I think his schizophrenia, right? So the eyes, as much as you can receive information through them, we can also deduce a lot of information from them. So take a look at your eyes. Are you fanatical? Are you suffering maybe from hyperthyroidism, hypoglycemia? Are you very acutely aware of things? Are you a narrow focused individual? Tell me your outlook on your life.